There was a receipt on the evidence table. It was for $41.17, a pharmacy receipt, the kind that prints long because they list every medication, every copay, every insurance adjustment in small gray font. This one had been folded and unfolded so many times that the crease lines had gone soft and pale. That receipt is why I am talking to you today. Let me tell you how we got to that moment. I have been on the bench for 22 years. I have presided over more than 4,000 cases. I have seen fraud. I have seen negligence. I have seen people make decisions so careless that others died because of them. I have watched men and women sit in that courtroom and explain, in calm professional language, why the thing they did was not their fault. I have watched that more times than I can count. But I had not, before this case, watched a man explain why a child's father deserved to die because the numbers did not add up. That is what this case was. Underneath all the legal language, underneath the motions and the filings and the corporate exhibits, that is what this case was. If you want to hear the rest of this, and I think you should, subscribe and turn on notifications. I am not saying that for the numbers. I am saying it because this story deserves more ears than it has gotten. Hit subscribe. Then let me continue. His name was Marcus Teller. He was 39 years old when I first saw him walk into my courtroom. He came in on a Tuesday morning in February, and he was wearing a gray dress shirt that was slightly too big in the shoulders. I noticed it because he had ironed it. You could see the crease lines down the front. Someone had taken care that morning. I did not know then that his oldest daughter, 14 years old, had ironed that shirt the night before because his hands shook too much to do it himself. I found that out during testimony. But when he walked in, what I noticed was that he had tried. Whatever the dialysis was taking from him 3 times a week, he had tried. He sat down slowly, not dramatically, just carefully, the way a person sits when they are aware of every joint. He set a folder on the table, put both hands flat on it, and looked straight ahead. He did not look around the room for sympathy. He did not look at the defense table. He just looked forward, focused on getting through the next several hours the same way he got through everything else. His 3 children were 11, 14, and 16. He had been raising them alone for 4 years, since his wife passed from an unrelated illness. That is what I knew about him when the day began. The defendant's name was Richard Call. He was the chief executive officer of a health insurance company called Meridian Coverage Group, which operated across 14 states and had, in the fiscal year prior to this case, reported net earnings of $431 million. I want you to hold that number for a moment. Richard Call was 54 years old. He wore a dark suit and a watch I recognized as expensive without being able to name the brand. He came in with 2 attorneys on either side and a third behind him, and he walked like a man who had been in important rooms before and was not worried about this one. He sat down and immediately began reviewing documents, not looking at Marcus Teller, not looking at me, not taking stock of where he was. When his own attorney spoke during the opening statements, he watched. When Marcus Teller's attorney spoke, he looked down, not at his documents particularly, just down. It was a small thing. I wrote it down anyway. Now let me tell you what happened to Marcus Teller before he ever set foot in my courtroom. He was diagnosed with end-stage renal disease in March of 2021 when he was 36 years old. His kidneys had been failing for 2 years before that. By the time the diagnosis was confirmed, he needed dialysis to survive, not to feel better. To survive. Without it, a person with his level of kidney failure has days, maybe weeks. The treatment was not optional. It was the same as breathing. Meridian Coverage Group had been his health insurance provider through his employer for 3 years. His policy covered dialysis. It said so in plain language on page 14 of his benefits document. He had paid his premiums on time every month. In September of 2021, a Meridian Medical Review employee sent a denial letter to his dialysis center. The letter stated that his ongoing treatment had been reviewed and determined to be, and I am reading from the document entered into evidence, not medically necessary at the current frequency of administration given the patient's documented response metrics. He found out when he arrived for his Tuesday appointment, and the front desk told him there was a hold on his account. He was 37 years old. He had driven 40 minutes to get there. He asked them to repeat what they had said. Richard Call signed that denial authorization. Not a lower-level employee, not an automated system. He signed it. His name was on page 3 of the internal authorization chain, dated September 8, 2021 at 11:47 in the morning. He said in testimony that he signed dozens of these authorizations weekly and relied on his medical review team's recommendations. He said, "My signature is an administrative function. I trust the process we have built." I wrote that down. If you are the kind of person who stayed with this story this far, not because it is dramatic, but because you actually want to know what happened, then you already understand why I am telling it. Subscribe. This is what I do now. Tell the stories that need to be told. The appeal of the denial took 6 weeks. In those 6 weeks, Marcus Teller missed 9 dialysis sessions, not because he chose to, because without insurance authorization, each session cost $3,400 out of pocket, and he did not have that. He had a mortgage, 3 children, and a job as a warehouse floor supervisor he was still going to 3 days a week between treatments. He had $41.17 at the pharmacy that month, which was what he could cover after he paid for his eldest daughter's asthma inhaler. He appealed. He wrote the letter himself. His attorney, who took the case pro bono after seeing the denial paperwork, told me during testimony that Marcus had written 3 drafts at his kitchen table in longhand because he did not want to get it wrong. The final version was 2 pages. It described his condition in clinical terms he had taught himself. It listed his children's names and ages. It ended with one sentence the attorney read aloud in my courtroom, and that I will not forget. Marcus Teller wrote, "I am not asking for anything I was not promised." The appeal was denied. Form letter, 11 days after submission. He missed 9 sessions over 6 weeks. The damage to his remaining kidney function during that period was documented by his nephrologist as significant and permanent. That is what we were there about. Let me explain one piece of the legal process because there is something most people do not know, and it matters here. There is a doctrine called bad faith insurance denial. Most people think of insurance disputes as civil disagreements. A company calls it wrong, you sue. Maybe you get your money back. Bad faith is different. Bad faith means the company made a decision it knew, or should have known, was not supported by the evidence and made it anyway for other reasons. When bad faith is proven, the penalties are larger. Executive liability looks different. It changes the whole character of the case. What crossed my desk before trial was a set of internal Meridian emails obtained through discovery. They were between Richard Call, his chief medical officer, and his head of medical review, dated July and August of 2021 before the denial was issued. The emails discussed what Meridian internally called high utilization accounts, policyholders whose ongoing treatments were generating claims above a certain cost threshold. Marcus Teller was named in one of those emails, not as a patient, as a line item. The email from Richard Call sent on August 4, 2021 said, "Flag the dialysis cluster for September review. I want authorization rates tightened across that category. We are carrying too much recurring cost in chronic treatment accounts." That email changed this case from a coverage dispute into something else entirely. I want to stop here for a moment, because what I am about to tell you is the part of this case that I had to sit with the longest before I felt ready to speak about it publicly. Subscribe before we go further. Take a breath, because this next part matters. The 3rd day of testimony was when the Meridian Medical Review Specialist took the stand. Her name was Patricia Howe. She had worked in that division for 11 years. She was not the villain of this case. I want to be clear about that. She had been given a process, had followed it, and had not been shown the full picture of why the process was designed the way it was. When she was asked whether she had reviewed Marcus Teller's actual medical records before recommending denial, she paused. The room went quiet in the way it does when everyone in it realizes something at the same moment. She said, "I reviewed the summary documentation provided by the intake system." His attorney asked, "Did you review his nephrologist's most recent treatment notes?" She said, "Those were not included in the intake summary." I asked her to repeat that, not for effect. I just needed to hear it again. She repeated it. The nephrologist's notes, which stated clearly that reducing dialysis frequency posed an immediate life-threatening risk to Marcus Teller, were in his file. They had been submitted by the dialysis center weeks before the denial. They were simply not pulled into the summary document the review team used to make their determination. Someone had designed a process that filtered out the most important clinical information before the decision-makers ever saw it. That process had Richard Call's name on its architecture. He was the one who had asked for authorization rates tightened across the entire chronic treatment category. That was the moment. That was what I had to ask her to repeat. I have been doing this for 22 years. The cases I choose to talk about publicly are the ones I believe need more people to know about them. Subscribe and tell me in the comments what is hitting you hardest so far. I read what people write. It matters to me. Richard Call's defense was not unreasonable on its face, and I want to give it its due weight, because I did. His attorneys argued he could not be held personally liable for a review system employing dozens of professionals that process thousands of claims monthly. They argued the August 4 email was standard cost management language, not a directive to deny medically necessary treatment to specific individuals. They argued the missing nephrologist notes were a documentation error, not intentional exclusion. These are real arguments. In a different case with different facts, some of them might carry. I considered each one carefully. That is the job. What they could not account for was the email paired with the data that followed it. Marcus Teller was not alone. Discovery surfaced 17 other dialysis patients at Meridian whose treatment authorizations were denied or reduced in the 3 months after that email. 17 people. Before August 4th, Meridian's dialysis denial rate was 11%. In the 3 months after, it was 43%. That is not a documentation error. That is a policy. The policy had an author. Richard Call testified on the 4th day, composed throughout, prepared carefully by a good legal team. But there was one moment during cross-examination when Marcus Teller's attorney asked him directly whether he had ever met a dialysis patient, not reviewed a file, not signed an authorization, but actually met a person who needed dialysis to stay alive. Call paused just slightly too long. Then he said, "My job is not to meet patients. My job is to ensure the company operates within sustainable financial parameters." He said that. I wrote it down. The verdict was not the hardest part of this case for me. The sentencing was. Because sentencing is where I had to decide not just what was legal, but what was right. Subscribe so you do not miss what I decided. I am getting to it now. There is something I want to tell you that has nothing to do with the law. My mother was sick for the last 3 years of her life, not with kidney disease, with something else, slow and expensive. There were months when I helped her go through insurance paperwork at her kitchen table and watched her try to understand what was covered and why the number on the letter never matched the number the doctor's office had given her. She was a retired school teacher, careful, organized, a labeled folder for every document going back 4 years. She still could not understand it, not because she was not sharp, because the system was not built to be understood. It was built to be navigated by people with time and energy to fight. By then, the illness had taken all of that from her. I thought about her kitchen table when I read Marcus Teller's appeal letter, the one written in 3 longhand drafts. I did not say any of that in court. It was not relevant to the ruling, but I thought about it every single day of that trial. I had made my decision days before I announced it. But the moment still lands differently when it is spoken out loud in a room full of people who have been waiting for it. The room was very still. Marcus Teller sat with his hands folded on the table. His attorney had one hand on his shoulder. Richard Call sat straight, face arranged in professional composure, both hands flat on the defense table. His lead attorney held a pen but was not writing. I looked at both of them. I looked at the gallery. I looked at the folded receipt still sitting in the evidence tray to my left. Then I spoke. "I am ordering you, Richard Call, to pay $6,400,000 in compensatory and punitive damages. $2 million goes directly to Marcus Teller for medical costs, lost wages, and what the law calls pain and suffering, though that phrase does not begin to describe what 6 weeks without dialysis does to a human body. The remaining $4,400,000 goes to a patient advocacy fund administered by the state health department, specifically designated for low-income patients navigating insurance denials for chronic illness treatment, not a general fund. That specific purpose, because the harm was specific and the remedy should be too. I am suspending Richard Call's ability to serve in any executive role at any licensed insurance company in this state for a period of 7 years. He cannot be a CEO, president, chief operating officer, or chief medical officer. He cannot sit on any board with operational authority over coverage decisions. He may consult, he may not decide, not for 7 years. One email on one August morning altered the medical outcomes of 18 people. Authority used that way requires enforced distance. I am ordering him to complete 200 hours of direct service at a licensed dialysis center in this state, not administrative work, not advisory work. As a non-clinical support volunteer, transporting patients, sitting with them during sessions, doing whatever the clinical staff direct him to do. He begins within 60 days. He documents each session with a signed log submitted to this court quarterly. I chose this form of service deliberately. I believe there is a difference between knowing that dialysis patients exist as a category and sitting in a room with them 3 hours at a time, 3 days a week. That difference needs to be experienced, not acknowledged in a statement. I am ordering him to write a public statement of no fewer than 1,000 words, published in full in 3 newspapers of statewide circulation, describing in his own words what his authorization practices at Meridian did to patients and what he would have done differently. His attorneys may not write it. They may review it for legal accuracy. They may not alter the substance or replace his voice with theirs. He signs it. It runs within 90 days. If this court finds it evasive or insufficiently specific, he rewrites it until it meets that standard. And finally, I am ordering Meridian Coverage Group as a corporate entity to fund Marcus Teller's dialysis treatment in full at whatever center he chooses for the remainder of his life, not contingent on employment status, not subject to future coverage reviews, for the remainder of his life. His children are 11, 14, and 16. That father is going to be alive to watch them grow up. That is not a courtesy. That is part of this ruling, and it is enforceable. Thank you for staying with this. I mean that. I know this is a long story. I know it is not easy. Subscribe if you have not yet. You already know why you are still here. Let me tell you what I said to Richard Call directly in that courtroom. I want to say it again here the same way. I said, on August 4, 2021, you sent an email that set in motion a policy that denied Marcus Teller 9 dialysis sessions over 6 weeks. The permanent damage to his kidney function is in this record. You did not intend to harm one specific man. You intended to reduce a cost category. The fact that human beings were inside that category was something your process was specifically designed to keep out of your field of vision. That is not a defense. That is the center of what you did. I said, your family is not before this court. I am not in the business of punishing people who made no decision here. I said, you reached the level you reached because you are capable and because the system you operated in rewarded the decisions you made. That capacity carries a weight that does not disappear when the outcomes become inconvenient. You do not get to set it down. And then I said the last thing, quietly, because I meant it that way. I said, Marcus Teller wrote you a letter. He told you he was a father. He told you he was not asking for anything he had not been promised. I am asking you, not as an order, but as one person to another, to read it. After today, when no one is watching, I think it will cost you something. I think it should. After the sentencing, the room began to move. Defense attorneys clustered around Call, speaking low and fast. Marcus Teller did not move right away. He sat with his hands still folded, eyes forward, the same way he had walked in that morning. His attorney was talking to him and he was nodding, but he was somewhere inside the moment. And then his oldest daughter, She had sat through the entire morning session in the third row of the gallery, walked through the low gate at the bar, and put both arms around her father's shoulders from behind. She did not say anything. He raised one hand and held her forearm. They stayed that way while the room moved around them. That was the last thing I saw before I stood. That is the image I carried out. The air in that courtroom felt like the air in a space that has been closed a long time and is finally open. That is the best I can do with it. Richard Call's team filed an appeal within 30 days. The appellate court heard it 8 months later and upheld every element of my ruling. Every element, including the lifetime dialysis provision and the 7-year executive bar. The appellate decision used the phrase willful systemic negligence. I had considered that phrase myself and decided the facts did not need it. I was not surprised by the outcome, but I was relieved in the specific way you feel relieved when something you were nearly certain about is confirmed. You realize how much quiet tension you had been holding without knowing it. On a Thursday in October, 14 months after the verdict, I received a copy of the public statement Richard Call had published. It ran in 3 papers as ordered. I read it twice. There were passages that still sounded careful and managed, but about halfway through, one paragraph read differently, shorter sentences, less constructed. He wrote about a woman he met at the dialysis center during his service hours. He did not use her name. He wrote that she had been coming 3 times a week for 6 years and had asked him once what he did for work. He told her he used to run an insurance company. She looked at him and said, "Did you ever actually talk to any of us?" He wrote that he had not known how to answer that. I do not know whether that paragraph means genuine change. I do not know if it is anything more than a man who found, in the middle of a court-ordered document, one sentence he could not edit away. But I noticed it, I sat with it, I decided it was more than nothing. There are other cases I want to talk about. This is not the only one that stayed with me. Subscribe and you will hear them when I am ready to tell them. The question this case left me with is one I have not answered cleanly, and I want to be honest about that. It is this: at what point does a process become a decision? At what point does a person who engineers a system that denies care become responsible for each life that system touches? Not because they signed each denial, but because they built the machine to exclude the information that would have stopped it. I do not have a clean answer. The law gave me tools for this case. But tools have edges, and I know what lies just past those edges, and I think about it. What I am more certain of is this: distance is not innocence. The further a person sits from the consequences of their decisions, the more deliberately that distance has to be constructed and maintained. It does not happen on its own. Someone builds the buffer, and if you built it, you are responsible for what it was designed to hide from you. I have seen that pattern before this case. I have seen it after. It does not feel like a theme to me. It feels like a recurring fact about a particular kind of power that is not being watched closely enough. To anyone who has sat in a waiting room and been told that what you need has been denied, that the thing your doctor said was necessary has been reviewed by someone who has never seen you and found otherwise, I saw you in Marcus Teller's face, not as a symbol. As a specific man who ironed his shirt and drove 40 minutes and still got told no. The exhaustion of fighting a system while your body is already fighting something else is not something I can fully understand from where I sit, but I have watched it closely enough to know it takes more from a person than most people will ever be asked to give. I want you to know I watched it. I did not look away. To anyone who has ever occupied a position like Richard Call's, not the specific conduct, but the distance, the architecture of outcomes that stays invisible, the question I wanted to ask him from the bench but could not is this: when did the people in your categories stop being people to you, and was there a moment when you noticed it happening? I am not asking that with anger. I am asking because I believe that moment of noticing is where everything either turns or it does not. If you are in that position right now, find out who is inside your cost categories, not the label, the actual people. Then do something specific with what you find. There was a receipt on the evidence table, $41.17, a pharmacy receipt folded soft at the crease lines, 1 asthma inhaler, 1 month of a father making the math work however he could, covering what he could cover, getting his daughter what she needed before he thought about himself. That is why I told you this story. If you want to hear the others, and there are others, subscribe. That is all I am asking. Subscribe and stay. The comments are where the people who care about the same things find each other. I have read them. I will keep reading them. Marcus Teller.